Hi, I'm Andrei Fermin. I'm a student nurse, and I will be taking care of Penelope Pacheco here, and I'm just going to read off the doctor's order real quick. The doctor's order states that she has a respiratory infection, and patient's Penelope Pacheco, and the doctor has ordered Cefazolin 750 milligrams through IV, which is due right now and will be given 3 times a day. It also states that she is currently running through normal saline, and according to the drug monograph, that normal saline is compatible with the drug we're giving right now. Okay, so we have our drug here. We're going to do our first med check. So, right patient, Penelope Pacheco, states that she has no known allergies. Okay, so we have our right drug here. We can also check if there's any expiration dates. There's none. And the right dose, 750 milligrams. I give an IV every 8 hours, and it's due right now. And we also have to check if that dose that is prescribed is within the safe dose range. So it says that the usual dose is between 500 milligrams to 1 gram, so 750 milligrams is within our safe dose range, and our vial is enough for that medication because it's a 1 gram vial. Now we will do our constitution. It says that for a 1 gram vial we would have to add 10 milliliters of sterile water for injection. So we have sterile water here, and that final concentration would be 96 milligrams per milliliter. And according to my calculations, that we would, after reconstitution, we would draw up 7.9 milliliters. And also to address the other 5 rights, for a right reason, we are giving an antibiotic for a respiratory infection, so that makes sense. We also have to educate the patient on what the drug is and any effects it will have. Our right evaluation of the effects of the drug. And we could also look in the back here for potential hazards of the drug. It states that they can get rash or itchy skin here. And we also have to know that we have to have the right documentation, which is right here, correct documentation. We also have to understand that the patient has the right to refuse. So we'll go ahead with preparing our medication. So we're going to swab both vials. 30 seconds has passed. Another one. Sterile water. Sterile water. Okay, 30 seconds has passed. Okay. So we'll need 10 milliliters of sterile water, and we have a 10 milliliters syringe here. Okay. So we'll drop approximately 10 milliliters of air here. We've already swabbed this and let this dry. Any air bubbles there?
Just kidding, I'm changing it right now.
Getting rid of any air bubbles because that will affect the amount of sterile water we do draw up. Okay, we have 10 mLs of water. Okay, and we've already swabbed the top of this and let it dry, and now we will instill 10 milliliters of sterile water into the vial here. And now, according to our calculations, we need to draw 7.9 milliliters from there, but first we would need to mix up the medication and roll it just to make sure all the medication is mixed very well. And before we draw that 7.9, we'd have to swab it again just to make sure it's sterile. Okay, 30 seconds has passed, and now we will draw that 7.9, but first we have to draw approximately 7.9 milliliters of air to help with the suction. Get rid of any air bubbles, because that will affect the amount of medication we are giving our patient. Okay, we have 7.9 milliliters. Yep. Okay. And now we will do our second med check. So, right patient is Penelope Pacheco. Our right drug, Cefazolin, is right here that we drew. 750 milligrams equals to 7.9 milliliters, which we have here, given through IV every 8 hours, and it is due right now. So, we also, the drug monograph also states that we need to dilute this medication in 10 to 100 milliliters of D5W, normal saline, or a combination of dextrose and saline, and administer it over 20 to 60 minutes. I chose to use 100 milliliters of normal saline because if someone's having a respiratory infection, the more fluid they get, the easier it is to secrete. The secretions become thinner and easier to get rid of them. And I'm also choosing to administer it over 60 minutes because I don't want my patient to be fluid overloaded. But before we do any put the medication here, we just have to check the integrity of the bag, making sure that there's no foreign particles, making sure that it's the right right formula that we're using here. So before we instill our medication in there, we will swab again. So 30 seconds. Let it dry for 15 seconds. Okay, 30 seconds passed, and then 15 seconds also passed to dry. Now we will instill our medication. Still medication in there. Okay, now we'll make sure not to bring this to the bedside, so we'll just put it away here. And now we will have to label our mini bag here. So with the patient, the drug, Cefazolin, dose 750 milligrams, the total volume of this bag would now be 700.9 milliliters. And it is due right now, and we're giving it 3 times a day, and I'll also place my signature. And when I place this label on the bag, I have to make sure that I'm not covering any parts of the bag that has any information on it. So just put it on the side here. Okay. And now we are ready to go to bedside. So yeah, again, I'll bring in the needle. Hi Penelope, I am Andrei Fermin. I am your student nurse for today. I will be giving you your medication. Do you have any can you give me your full name, please? Okay, and how old are you? Okay, perfect. So that's our first check right there for the patient. And do you have any allergies? No? Okay, and now we will do a quick safety check, making sure that there's no spills on the floor and that all the tubing is properly placed. Okay. And while we're here, we could also check the IV side to make sure that there's no inflammation, any redness, or if the patient has any pain, and you can ask about that. Are you in any pain? Okay, no, so IV side looks pretty good. And now we will do our final med check. So we did our first check the right patient. So we're gonna go with the right medication, so Cefazolin. The right dose, 750 milligrams, given through IV every 8 hours, and it is due right now. Okay, so now we will move this over. Okay. So we'll just check if the current bag is running, and it is normal saline, so it is normal saline in here. Okay, so first we have to lower our primary bag.
And now I'm going to make a label. I have the patient's name, Jamie Frazier, the drug methylprednisolone, the dose 100 milligrams, the volume 1.6.
And actually right now I'll start with educating my patient. So this medication we're giving you, Penelope, is for your respiratory infection. It will help get rid of that bacteria that's causing that respiratory infection, and you might incur symptoms of your stomach, maybe some stomach cramps, nausea, vomiting, diarrhea, and if that does occur, please let us know, and we'll address those problems for you.
And with my tubing, I'm going to have a label, the time, the date, and the name. And I'm going to get my mar.
So while we connect our tubing, you gotta make sure, check the tubing for its integrity, and there's no clear breakage of sterility. Okay. So we'd have to swab this port right here for 30 seconds. 30 seconds has passed. Okay, now without ruining the sterility, we will connect the port to the IV line. Okay. Okay. And we will connect the tubing to the bag, maintaining sterility, making sure that the spike does not touch anything else. Okay, now we will back prime, so we will lower this below the primary, making sure that there's no air bubbles within the line here. And it looks pretty good. Pull the clamp off. And I have to make sure we have 1/3 or to 1/2 with this chamber with fluid. Okay, we'll close off the clamp here. And now we will label our line with the drug, the time we administered it, and the initials, and also maybe the rate of the medication. Okay, so now we will set the rate, which would be given over an hour. We have 107.9 milliliters of fluid, but the machine does not accommodate for that many numbers, so we're just going to round up to 108. So we're going to set that. So 108 milliliters an hour, 108 milliliters total volume. And now we will begin our secondary. Open the clamp, and we'll watch for 3 drops here. So we already have 3 drops there. Okay, make sure the line is running. And before we leave, we will let the patient know that we will be coming back in, or we'll stay here for a bit to just make sure that there's no adverse effects right away, and we would just let them know to give us a call with the call bell if they have any issues, and we'll be back in approximately 30 minutes to an hour to see how they're doing. But before we leave, we'd have to make sure that we sign off on our medication. And yes.